Hello, everyone, and thank you for coming on to our live this evening. I trust that your week is off to an amazing start. And if you are watching the replay, I hope that you're just having a great time within your business. Um, as usual, every week we come live to have some discussion to support you, medical practitioners, healthcare workers within your private practice, or even if you're still in the public sector or you're working for someone. And tonight we're having a conversation about, just uplifting what is happening this month, which because it's Black History Month. And we have a guest with us. If you're new to our live event weekly, I am Michelle O'Connor and I'm a business advisor for private practice owners, where I help you to increase your profit and also increase your time. So we're all about taking care of you and making sure that while your practice grows, you also grow with it. And tonight we're going to be talking to one of our special guests that's coming on. If you're joining, say where you're joining from, leave a comment. If you have any questions as we go through, feel free to ask. We're here to have conversation in this virtual world. And so we have Celia McIntosh with us this evening. And she is doctorally prepared psychiatric mental health and family health nurse practitioner. She has worked as a nurse and she has also worked as a nurse practitioner for several organizations, and she recognized the need to improve psychological health for patients with stroke and implemented a protocol for acute stroke patient to help them with recognition. Now she combines her medical training and her commitment to raising awareness about trafficking victims through the development of several programs for healthcare professionals. She's respected, she's a speaker, and she's also a career coach and mentor, podcast host. Where she find time to do all of these things, she's going to tell us shortly. And she advocates for nurses and persons in the healthcare sector. Celia, welcome and thank you so much for coming on our live show this evening.
Thank you. Thank you for having me. It's a pleasure to
Yeah,
be here.
I made a post this morning and I was saying that, our healthcare workers are those who are on the field, you're there, you're a quarterback. Thank you for coming on, Eric. So talk to us, tell us a little bit about what you do and how you got started.
So currently, I'm a nurse practitioner in the neurology inpatient unit, and I see a lot of patients with stroke, seizures, multiple sclerosis, just a variety of different illnesses. Um, how I got started? Well, I actually started my journey as a home health aide, and then I went on to be a certified nurse's assistant. And it was around that time that I decided that I wanted to go back to be a nurse. And the reason why I wanted to go back was because I wanted to advocate for patients and their families. I was just seeing some things in the healthcare field at that time that didn't align with integrity in a sense. So I wanted to be a voice for patients and their families. So I decided to go back to nursing school. I went on and I got a 2-year degree. Then I went to MCC, got a 2-year degree, went on to Brockport, got my bachelor's, and then from there went on to get my master's. Now, it sounds like it was a stepwise process, but there were some breaks in between. Along the way, I had a son, and once in 2008, I decided that I wanted to go back and be a nurse practitioner because I just wanted to learn more and
Yeah.
care for the patient in a different way. And then from there, I got my nurse practitioner. I worked for a couple years in the healthcare field, specifically in neurology. And then I encountered a patient that I got called to a stroke alert. I went down to see the patient, and everything they were describing was depression. And I said, do we screen for depression in our stroke patients? And that was what triggered me to then go back and go for my doctorate. So that was my clinical scholarship project. And from there, I decided that I wanted to also have some expertise in psych mental health because before I actually entered the healthcare field, I own my own daycare, and I saw just some behaviors with the children that I wondered how they grew up to be productive adults. So I think I was still really wanting to know a little bit more about that. And that was one of the triggers for me to go back and get my nurse practitioner, but it was also a huge overlap of neurology and psychiatric illnesses that I really wanted to learn a little bit more. And that's essentially how I arrived here. And then
It sounds like a lot. It sounds like a lot. And, I want to go back to the advocacy, but we'll get there. I want you to share, because you talk about, working as a nurse, you have a daycare, then, talking to stroke patients. What was, maybe share with us one of those highlight moments for you on your nursing journey?
I would say the biggest contribution was really going back for my doctorate. Really, and I think it was the encounter that I had with my patient that was describing depression. That was life changing for me because not only was I able to pretty much address an issue at the bedside with him, I was able to now go on and get my doctorate and now really help populations of patients with strokes. So, I've basically, since that time, I was able to write an article, which has been, cited by 23 other individuals, one organization being in China. So I'm
Interesting.
having that kind of international impact as well. From there, I was able to, I've educated over 1,000 people specifically around, the depression screening protocol that I developed in 5 different states, 2 different countries. So even with that, just having that encounter with that patient that day that talked about depression, I was able to maybe not help him specifically, but able to develop a protocol within the organization that are now able to help, has the potential to help 700 people that come into the hospital every year. So we encounter 700 patients that have stroke. Now they have a tool that they can use to screen them for depression. And that tool has been implemented for about almost 10 years now.
That,
So it's captured, so it has the potential to screen a lot of patients. And like I said, just being able to go to different states and do different presentations about my work has really helped other organizations.
and what would you say is maybe one of the things that we miss when it comes on to depression and stroke, based on your work and the research that you've done?
I think just the awareness about it, because people think, okay, well, you had a stroke, you're supposed to be depressed, and they just chalk it up to that. They really don't go a little bit deeper and really explore. Okay, well, if they're depressed, they're not going to participate in their therapy, and if they're not participating in the therapy, then the extremities that are weak are going to get weaker and more contracted, and then they're more disabled. It has a long-term impact. Whereas if you are able to identify it, and everyone manifests depression a little bit different. I've noticed with males that have stroke, they tend to have more aggression, agitation. So some people may see that and become frustrated with dealing with them because they're agitated, they're they're upset all the time, but really it could be a mimic of depression. And instead of engaging with that individual, you kind of write them off because you don't want to deal with someone that's being aggressive, right?
Yeah.
So those are some of the things, but really being able to understand that this happens to 2/3 of patients with stroke and really being able to see the signs. So if they're not participating in therapy, if they're sleeping a lot, if they're not engaging, if they're losing interest in things that they used to do and find joy in, those are some of the big things that we need to pay attention to.
Wow, it sounds like we can have a whole discussion on that alone. So thank you again for coming on. We're talking to one of our superheroes in the medical field today. So we have persons who are coming on from different states. So thank you for being here. If you have any questions that you want to ask, go ahead and drop it in the chat. So you shared with us one of your highs that you can remember. What has been some of the challenges that you've experienced as you've been through your journey?
I think for me, the biggest challenge is not being where I want to be. Sometimes you have a certain plan for your life, and you have this roadmap for your life, and it doesn't work out the way you want it to.
Yeah.
So life happens and you get derailed. So I think that in itself, you kind of beat yourself up and say, I wish I would have done this sooner, or I wish I could have that time back. So I think that's one of the things that's really been challenging, is to see myself further than where I am, even though I know I'm doing impactful work.
Yeah. And I think, a lot of us go through that. We have this grand plan for our life, and then things happen and you sit back and you're wondering, what did I not do? Or, did I come off the road too quick, or should I have made a turn? And it can be challenging. Persons see everybody showing up daily and they're thinking, yeah, they've got it, they're making an impact. But it's something that we all battle with, no matter how much we show up for those who are joining.
Mhm,
So no matter how you see somebody showing up, we all have those goals and those dreams for our lives that we tend to miss.
mhm.
So on your journey, in your bio, it spoke to you being an advocate for anti-trafficking. How did that happen?
So in 2013, I was doing some sexual assault kits. I have a passion for law and nursing, and I wanted to combine the two. So I decided to become a sexual assault nurse examiner, and I would come into the hospital, collect the kits. But I did that for about a year, and I didn't feel like there was any continuity of care. So I decided I wasn't going to do that anymore, and I was walking into work. And there was a conference happening that day, but there were a few different tables out. And there was a company, an organization, the Rochester Regional Coalition Against Human Trafficking. And I saw this big poster that said human trafficking. That was back in 2014. And I was like, what is human trafficking? I've never heard that term before. I've been to 3 different schools of nursing, and I've never heard anyone talk about it. So once they started telling me about it, and I started seeing like all the pamphlets on their table, I just became very curious. And I felt like it was a call to action, because now I couldn't unsee it. Because when they were telling me about that someone would force someone to have sex with multiple people and take their money or beat them or trick them, I just had to learn more. So from there, I started doing my own research. I found out that that was the same year that a landmark study came out, 2014, basically saying that 88% of victims come in contact with healthcare providers. And we had no idea. I had no idea. I'd never heard anything about red flags. I've never heard of the term human trafficking. So I figured if I didn't know anything about it, that I needed to start educating my peers about human trafficking. And that's really how it started.
So what has been the is there, or let me ask it this way, what has been the impact that you have been able to make within, you're sharing with your peers? Is it that you're more aware of persons who come in, you're able to connect with authorities? What has been the impact for that?
So the impact that I had initially was just becoming a resource to the community. Once I learned about it, then I started educating other providers. So to date, I've educated over 5,000, various nurses, physicians, social workers, faith-based organizations, schools about human trafficking. So definitely have increased the awareness about it. One of the biggest things that came out of that was because I had that experience, was that I was able to be the content expert and develop a protocol for my organization. So developing the policy, the protocol, the training for staff, not only nurses, but the physicians, the advanced practice providers, the security, the receptionists, so they can know what their role is when they encounter someone that's been trafficked. And that has become an organizational system-wide policy, and that's been in place for almost about 4 years. that in the screen, the tool has been embedded into the electronic medical record for about almost 4 years now. So not only was I learned from the community and was able to impact the community, now I use that work and that knowledge to impact the organization so that the patients that are coming into the hospital can be screened as well.
Good stuff. So I have persons online who are nurses and who are in the field, and it sounds as though you've achieved a lot and you've done a lot of things. Has it been easy for you to move through the ranks and as you get your qualifications to make that impact? What has that journey been like?
So within the organization, I would say that it has not necessarily been easy for me to move through the ranks in terms of getting to the next level of leadership within the community. And once I noticed that I was hitting those roadblocks within the organization, that's what led me to do more advocacy, more community engagement, more work in the community to get those skills that I needed to lead. And so I haven't gotten to those positions that I would like to in the organization. So I had to pivot and find other alternatives.
And I'm happy you said that because we want to talk to persons who are looking to move to the next level. What do you do when the plans that you have doesn't work out? Do you quit or do you find another way? So we have other persons joining, so thank you guys for coming on. If you're new to the community, I'm Michelle O'Connor, and I'm having a conversation tonight with Dr. Celia McIntosh, who, as you can hear, is impacting her community in various ways. So do you think, it's Black History Month and we're highlighting nurses and we're highlighting, just Black people in general based on the impact that we're making. Have you found your journey different because you are Black?
Oh yeah, absolutely. I Within the organizations, you can't help but to think about some of the things that you go through if it's related to race. I've had some patients, with racist comments, refusing me as their nurse for their family member. They would say that it's not related to race, but you can't help but to wonder if that is an issue. Some of the, bullying, some of the discrimination I haven't seen that, and I've had more of that experience the higher you go. So where I didn't really experience that as much as a bedside nurse, when I became a practitioner later on in my career, even over the last 3 years, I faced a lot of discrimination, a lot of othering, a lot of just racism,
Yeah. And
essentially.
how did you manage that? Why do you continue? I know you stated why you started. How have you been able to manage? And as you talk about even in your bio where you're taking care of person's mental health, how do you manage that on a day-to-day basis?
Well, I think one of the things is that I know that you s- I don't you still have to deal with it. So for me, it's a matter of how do I deal with it. I still have to exist in this world. I have to still
Yeah.
exist in a organization. I still have to, do the work that I'm doing independent of this other stuff. So I think for me it was, becoming more aware because I want to know, is there a role that I'm playing in any of that?
Yeah.
How
Because
am I?
I want to just make a point on that because sometimes we're talking about healthcare, but it happens in many different fields. And
Yeah.
as you said that about the role that you're playing, it's good when you have that perspective that you're not just looking out, but you're also looking in.
Hmm.
And that's also very important. So I just wanted to highlight that it's very important for us to look in as well to see what is existing. And I see Eden on here saying facts. I think maybe they're having the same experiences, but you can to share some of what you were just saying.
Yeah, because what I understand is you can't change other people. You can't
Yeah,
change how they view
for
you. You
sure.
can't change hearts and minds. So I think a lot of the work that I do is like you mentioned, the internal work. Is there anything that I'm doing? How am I showing up? I can't change someone's perspective, but I can change how I react to what they said to me. I
Yeah.
can be more strategic about how I respond. And once I started doing that, what I noticed was that the provider that was being, having those discriminatory comments and othering me, he would change. He would escalate his behavior because he could not get that rise out of me. He
Mm.
couldn't get that response out of me. So when I realized that self regulation that I was doing for myself was now helping me, and it was exposing him, really. So other people could now see that, he is
Maybe you're
treating
not
her
the problem.
different. Right. So I think for me, I love the profession that I'm in. I love the impact that I'm having on patients.
Yeah.
I love the influence that I can have on them, just on my community. Um, you know, I want to be that resource for them. So I'm not going to allow someone to make me prematurely stop providing the care, stop showing up, stop being the provider, stop, becoming the version of me that my
Right.
community needs. So that's why I essentially keep going, because I want to change things. Um, and I thought that having to go through this experience, I could help other people.
Yeah, and I think it's important that when you talk about self-regulation, because sometimes when you are the agitator, you're also involved in that. It's very hard to decide who is where, and you're able to highlight that there's somebody else. So when you think of your next phase, I mean, you're doing mental health. I love the work that what you spoke about in terms of depression and stroke. I think that's a very good conversation to have, because if you think about Black people and how we're educated about our health, what we eat, and our lifestyle in general, not just what we eat but our lifestyle, there isn't a very good correlation, or we don't talk about that a lot. Persons wouldn't really put that together, and it's that work is really good, because knowing persons go into the healthcare system, and I really hope you're able to broaden that and send it to many different places, because that is good for persons to really understand. But when you think about your next phase and the next journey, what does that look like for you?
More policy, more advocacy. I definitely am very passionate about health policy because I know that even though I'm impactful at the bedside, even though I'm impactful as a nurse practitioner, sometimes changing, you know, I have to be at different tables. I have to be at those policy making tables to change the things that I see at the bedside and
Yeah.
how they impact my patients. So I see myself doing more things around health policy, governmental, global health. Um, that's where overall.
Yeah, and I think you'd be great at that. For those who are joining, if you have any questions, go ahead and drop them in the chat, so that we can respond to them. So you are also a consultant.
Mhm.
What do you do in that realm of your journey?
So my major thing is that I help healthcare professionals specifically navigate toxic workplace culture and really self advocate because like I said, when you're in the middle of it and you just feel you're being tormented, you're being, um, othered, you're being discriminated against, you internalize that. So,
Yeah,
really helping professionals deal with that. And some people may say, well, they should just leave. They shouldn't deal with it. But the reality of it is you still take that negative experience with you.
it's
You
with you.
never, right,
Yeah,
you never unpack it because you never got accountability from that toxic boss, that toxic coworker, that tormenting thing,
yeah.
that targeting and that bullying that happened to you. So you still need to be able to process it. You still need to be able to deal with it. You still need to develop strategies. So that is my role. That's what I help with.
So, without giving away too much about it, what are some of the tools that you use to help persons to navigate through those toxic relationships?
Well, one of the biggest things is the self regulation piece. Emotional intelligence is huge, but even identifying your triggers. That is one of the biggest things. Recognizing patterns is a major thing. When this person says this to me, how does it feel in my body? How do I
Mhm.
respond to it? What is it triggering? Because I've had people even say that, when they have these issues, these bullying things, it triggered childhood trauma. So really being able to understand what happens to you when this
Yeah.
bullying is happening. So,
And
and
just want to make a point on that. I think it's very important. We sometimes make light of it when we talk about what is triggered within us when something happens. I've shared this with someone. I did a training maybe back in 2020, and what I thought it wasn't, but it was more than what I could have imagined. And one of the things that we were doing was that we were working on our vision for our life. But in order for us to work on our vision, we had to figure out why haven't we achieved it as yet. And it's exactly what you shared. Working through when you thought of this thing or thought of achieving this thing, there's something that stopped you. What is it?
Mhm,
Why do you think it stopped you? You need to get over it. So I think that self-awareness and that emotional intelligence in the organization, wherever you work, is very, very important. Sometimes we go in thinking it's the other person, but when you're able to self-regulate, it makes you feel a lot more at ease. You're not overly anxious, and it may be something in the organization that's triggering you right now. But if you leave and, as you said, don't deal with that internal piece, you could go somewhere else and something else could trigger it. So I think that's a very good aspect of it for persons who are on. So if persons are on and they're interested, how can they reach you to get connected and have you support them through this journey? Because I see persons online saying facts, yes, with all hands raised. So there are persons who are experiencing what you're talking about. How can you support them on this journey?
So they can actually find me right here on LinkedIn. When we get off, I can drop my LinkedIn
Yeah, and I'm going to drop it in
contact
the
here.
chat just now so persons can connect with you immediately if they haven't done so as yet.
Yes, absolutely. And then I can send them a calendar invite for a meeting.
Okay, so I'll drop it in the chat and you can connect with her. Okay, I see other persons joining. Thank you for coming on. We're actually wrapping up, but we have the live replay here. You can always watch. So as we close, is there any final words that you have? It's Black History Month. Any words of encouragement that you have for persons who are of color, who are in the nursing or in the healthcare industry? Any words of encouragement as they continue on this path?
Yeah, the one of the biggest things is you're enough. You are enough. Okay, that I want you to take up space because
Mm.
you belong at these tables, you belong in these organizations, you belong, getting those degrees, walking across those stages. So don't let your past and what people have said, especially the naysayers that said, you're not going to do this, you're not going to do this, don't let them deter you. You keep going, don't give up. All those things that sound very cliche are what you need in your toolkit to get you to the next phase of your life. So I would say keep going. Don't let anyone tell you that you're not good enough. We have to get back to community, though. I think that our community, we need some strength in that way, and we need the support. And I think a lot of the reasons is oftentimes in these, especially when you're going to higher spaces, getting those advanced degrees in these corporate positions or in these healthcare C suites, you feel alone and you feel like you don't have that support. And we really need, as a community, to get back to community and provide the support. But I would say you belong in every room. Okay, like Minda Hart says, you belong in every room. So I would say just keep going and know that, you know, there are people out there that are waiting for you to, get where you need to be in terms of, just your career. So you can encourage them as well. So I would just say, keep going. You
Love
belong.
it. You are enough. You belong and take up space. I mean, I heard that I got that term, we're at a conference in Puerto Rico in January, and that was the theme: take up space. Like, you belong here. You're answering a question, stand up, take up space. So I think, we got it. Yes, Aisha. Yes, you are enough, and take up space. Thank you so much for coming on and having this conversation with us. I really appreciate it. And I'm sure our listeners got something from it. I'm getting hearts, I'm getting claps, I'm getting hands up. So they really appreciate the work that you're doing. Go ahead. I dropped her link in the chat. Please go ahead and connect with her. I think that being able to go through, being someone who has been through internal work, it works, and you will be amazed as to what it can do for you. So go ahead and connect. Thank you so much for coming on and being with us this evening, Dr. Celia. I really, really appreciate it. And I'm sure we will continue to connect and hopefully do some more work together.
Absolutely. Thank you for having me on tonight.
Yeah. Thank you for joining us again for another live. We come live every week. I'm Michelle O'Connor. I'm a business advisor for private practice owners. If you own a private practice, you're looking to grow your practice, you want to find more time for yourself and not be overwhelmed and not be stressed, you can go ahead and connect with me on LinkedIn, or if you would like, I have dropped my calendar in the chat. You can go ahead as well and schedule a chat with us. We come live every week. If there is a topic that you want us to talk about, message us, DM us, you name it. And if you're watching the replay, still go ahead and leave your message. We go through on a weekly basis to see if there are questions or comments, and we keep in touch with everyone. So thank you again. It's been a very enlightening discussion. And remember, guys, you are enough, you matter, and take up space. Have a good day. Bye.